everyone. Happy evening, a very good evening. Am I audible and visible now? Okay, that's great. So finally we are here and yes, today we are going to discuss this topic of GIT hormones in physiology, that complicated table of GIT hormones. Now, why this topic selection for today? Because basically we have started with the new timetable from starting from today for students who have missed watching the previous video that we had regarding the timetable for NEET PG, AIIMS, FMG. So we have started today. So you are not late, you can join in. And today in physiology also, it is for the 5 days. That is basically from 11 to 15 July. It's from 11 to 15 July we have physiology, and today in physiology we have general and GIT physiology. So today, based on I had asked you inputs on what topics do you want me to cover in the physiology in these 5 days, so that whatever sessions we have, they go hand in hand with your daily targets. Of course, you'll be having surprise mixed bag session, other subject sessions also. So today we decided to have GIT hormones because there was some request related to this, and this is like a barbad topic. Now, what is the barbad topic? Basically, in my dictionary is BBD. That's your barbad topic is basically बार बार देखो वाला topic, right? It's like बार बार देखो, हजार बार देखो. So ये ऐसा topic है कि आप जितनी बार देखोगे, you need a lot of revision for this topic. Only once, right? It's not enough. So it's like no one can read just once. So basically this is hashtag BBD, that is bar bar dekho wala topic, and no one can read just once. It needs to be revised again and again. I mean, though we have discussed this topic in the past as well, but I know that this is a new league of students that is starting the next batch of students. So I'm going to tell you the easy tricks on how to remember these GIT hormones. Apart from that, we also have another session coming up at 8 p.m. today, and it's a free live class on Unacademy platform. That's a special class, and the next request from the physiology, that is muscle physiology, right? So we are going to simplify with easy tricks and mnemonics the topic of muscle physiology. So basically remember that in our sessions, it's going to be a mix of mnemonics, that is tricks, and concepts, right? As I always say, these are the only two things that are required to crack any exam, that is concepts. Where there are no concepts, something that needs to be mugged up, simplify it with mnemonics, right? I'll do both of those for you. So we are meeting again at 8 p.m. The unlock code for the session is Dr.Nikita. The link has been shared on the Telegram group already. Okay, the link has been shared on the Telegram group. Just give me a minute so that I can see the live chat. Okay, so I can see some queries already pouring in. That is, how will we get the PDF for today's session? So what I would try and do it to this YouTube session. After the session is over, please give me some time. I'll add the link in the description itself for the the PDF, right? So you can go to that link and download the PDF for the respective YouTube sessions as well. Okay, so that's what would be the plan would be. Okay, we have, right, so students who are following the timetable as we discussed, every day we would be having pre-test and a post-test as well, which will be there. Pre-test we had at 9 a.m. and I'm thankful to each one of you for the huge response. We had more than 400 students who participated, expecting even more students for the post-test. That will be at 9:30 p.m. right? So approximately 8 to 9 p.m., 9:15 p.m. we will have the class, and at 9:30 p.m. you will have the post-test. Okay, I'll be sharing the link on the Telegram group again. So good to go to discuss the today's topic. Any other queries, please put it in the live chat. I'll cater to you as and when convenient. Okay. And these are the various platforms where we can stay connected. So even on Instagram daily, there's a daily post that will help you revise, not just the daily target subject, but other topics also. So Dr. Nikita Nanwani, this is where we are on the YouTube channel, and the Telegram group is where all the communication happens regarding the upcoming classes. And this is at an academy platform that is at Dr. Nikita. All right. So these are the various places where we stay connected. Now, starting with the discussion of this topic, that is the GIT hormones. So tell me, which cells secrete which hormone? Okay. S cells secrete which hormone? I cells secrete which hormone? K cells and G cells. Now, out of this, the easiest to remember S and G. Okay, S and G. So S for S, that is secretin. Okay, S secretes secretin. G for G secretes gastrin. Okay, G secretes gastrin. Third, I and K is somewhere I is not for I. Do it the opposite. That is I and K is basically opposite. I is for K and K is for I. That is the I cells secrete the hormone, okay, which has the K in its word, that is CCK. K cells secrete the hormone which have I in their spelling, that is GIP. So basically remember that I is for K and K is for I. Okay, so CCK is basically cholecystokinin and K cells is GIP. Okay, that is GIP, glucose dependent insulinotropic peptide. Okay. Now, this is done with the cells. Now, going to the next one. So, these are the flashcards that I've put for you. Tell me which is that GIT hormone out of the list that we have seen, which stimulates everything. By that, what do I mean is, it stimulates gastric motility, intestinal motility, it stimulates the mucosal growth, everything. Basically, it stimulates the acid secretion. So which is that hormone, the GIT hormone? Is it secretin, cholecystokinin, gastrin or GIP? Remember, it is gastrin. Okay, it is gastrin which stimulates everything. How do we remember that? When you write gastrin, the GAST. So remember, gastrin is all stimulatory, that is GAST. Okay, basically gastrin is GAST. So remember that basically G for gastrin is all, ST is stimulatory. So gastrin stimulates everything. Okay, gastrin stimulates everything. Okay. So that is very, very important. We'll see and summarize everything at the end, the table also. Next one, which is that hormone which stimulates the intestinal motility, but it inhibits the gastric motility. Which is that GIT hormone which stimulates the intestinal motility but inhibits the gastric motility? Is it gastrin? Is it GIP? Is it CCK? Or it is secretin? Absolutely right. It is cholecystokinin. See, now when I gave you the four options, that is gastrin, right? Then you have GIP, then you have CCK, and then you have secretin, right? The four options here. Gastrin, we said, is all stimulatory, so it does not inhibit anything. So gastrin is out. Gastrin is out. GIP is your glucose dependent insulinotropic. So basically the only function is to stimulate the insulin release, right? Nothing to do with anything else. उसका सिर्फ insulin से लेना देना है, बाकी कुछ नहीं. जो CCK है, right? We said CCK is secreted by which cells? I. K is for I is for K. So remember that I is also for intestinal motility. It stimulates the intestinal motility. Everything apart from gastrin inhibits the gastric motility, right? So what inhibits the gastric motility? It is secretin and cholecystokinin. But what stimulates the intestinal motility? It is cholecystokinin. Secretin inhibits both. Let me show you this table. Right. So look at this table. If I ask you to complete this table, the effect of the hormones on the gastric motility and the intestinal motility. So first one, tell me, what does gastrin do to gastric motility and intestinal motility? Gastrin is all stimulatory, right? Gastrin is all stimulatory, So it stimulates both, right? It stimulates both gastric motility also and intestinal motility also. Cholecystokinin, tell me what does it do? So remember CCK, K is for eye, it stimulates the intestinal motility, it inhibits the gastric motility. Okay, it inhibits the gastric motility. Secretin, as the term says, remember basically secretin stimulates the secretion. It has nothing to do with the motility, right? It has nothing to do with the motility. We'll see what secretion does it stimulate. So remember secretin, it inhibits both the motility. Okay, it inhibits gastric motility also and it inhibits intestinal motility also. Is this clear with everyone? A quick thumbs up everyone that you have followed so far whatever we have discussed. Yes? Waiting for the quick thumbs up so that we can go to the next slide. Okay, that's great. So we are basically done with motility, the gastric motility, intestinal, gastrin, all stimulatory, CCK stimulates intestinal and secretin inhibits both the motility. Now going to the next one, which is that hormone whose only stimulatory action is insulin release. Easy one, right? It's the GIP because GIP is glucose dependent insulinotropic peptide. Previously, it was called gastric inhibitory peptide. It inhibits the stomach. Now it is your insulinotropic. Remember, the only function is insulin release. It stimulates the insulin release. Okay, that's GIP. And from where this GIP comes? It comes from the K cells. I is for K, right? The K cells. Next one, which is the only GIT hormone which is stimulated by all, like whatever you eat, whether it is sugars, whether it is amino acids or it is fatty acids. Again, the four options here. Is it gastrin? Is it secretin? Is it GIP or it is CCK, right? The four main hormones that we need to know. Only GI hormones stimulated by all, be it amino acids, sugars or fatty acids. Read the question very carefully. It is not that only GI hormone which stimulates everything. It's the other way around, that this hormone is stimulated by whatever you have, right, whatever you have eaten basically. Yes, it is GIP. Okay, remember it is GIP. GIP because basically it is insulinotropic, right? And we know that insulin increases in the fed state. So whatever is in the fed state, whatever we have had in the fed state, that is what is stimulated by all. Gastrin predominantly is stimulated by, the most potent stimulator is peptides. Here it is amino acids, sugars, fatty acids which stimulates this hormone, that is GIP. Insulin in the fed state, whatever you eat, basically insulin anabolic hormone. Okay, so it's GIP. So remember, insulin comes in the fed state. So all the three basically stimulate GIP. Next one, coming to some MCQs that have been asked previously in the exam. So you have eye cells secrete which hormone? Eye cells, where are they present? They are present in the duodenum. So I is for K. Remember it is cholecystokinin, right? So look at this, the notes here basically that I've given you. So remember I is for K and K is for I. So GIP is by the K cells and cholecystokinin is by the I cells. Okay, cholecystokinin is by the I cells of the duodenum. Next one, which of the following inhibits the gastric secretion? Which of the following inhibits the gastric secretion? What do you think would be answer to this? Okay, let me see the answers. Now, anybody who thinks that B is the answer, let me tell you, ruling out is a very, very important cheat code that you should be using in your examination, the MCQ based exams. The first option to be ruled out here is B. The answer cannot be high gastric pH. Why? Because see, gastric secretion basically means acid. So when you have high gastric pH, that basically means it is alkali which is present. So to neutralize that, we need the acid. So it will stimulate the acid secretion, right? So the first one to be ruled out is option B. Because alkali will stimulate the acid for neutralization. Now the next one, remember it's secretin basically, which is inhibitory to the stomach. Okay, so remember that secretin, S and IN. Remember the first and the last. Okay, that is secretin is basically inhibitory to the stomach entirely. Okay, stomach mein everything is inhibited by secretin. Be it the, okay, right. So it is, be it the motility of the stomach or be it the secretion of the stomach, right? So remember, it inhibits the gastric secretion. What it stimulates, secretin basically stimulates your pancreatic ductal secretion, not the gastric secretion, the bicarbonate secretion from the pancreatic duct. Okay, so which inhibits the gastric secretion? Gastrin stimulates all. Okay, gastrin stimulates all. So remember that it is secretin, which is stomach mein everything inhibitory. That is what will help you to remember. Okay, so what is the trick to remember? That secretin is stomach mein everything inhibited. Okay, stomach mein everything inhibited. All right. So SEIN, motility also and the secretion also. Okay. So remember the answer is secretin, which is inhibitory to the stomach. So next one, now you have this table, right? So you have this first one, then you have the second one, the third and the fourth. Identify each of these hormones. What do you think is the first one? What do you think is the first hormone here? Which hormone is the first hormone? Are you guys able to see that? If you want, I'll zoom this table for you. Okay, one by one we see this. Right. See, the first one is, you have been given in this table the stimulus and the actions. So the action is it increases the gastric acid secretion, right? So as soon as I say that gastric acid secretion, it is gastrin, right? Stimulates the growth of gastric mucosa. What stimulates? The peptides, amino acids. When the stomach is distended, basically the food going into the stomach, distending the stomach, you want acid, so the gastrin comes into play. Vagus acetylcholine wala, that is also stimulatory. Remember that it is inhibited by acid in the stomach. It's like a negative feedback. If already there is H plus, the acid in the stomach, you don't want gastrin, you don't want more acid. It's inhibited by somatostatin. Remember, somatostatin is static. It inhibits the gastrin. Okay, it inhibits the gastrin. The first hormone here is gastrin. Tell me, what is the second one? What do you think is the second hormone? Read the description and tell me what do you think is the second hormone here. Stimulus is small peptides, amino acids and fatty acids as well. Stimulates the contraction of gallbladder. It stimulates the contraction of gallbladder. That's a very, very important clue here. So as soon as you see it is gallbladder ka stimulation, most potent is gallbladder matlab cholecysto. So this is cholecystokinin. Remember the fatty acids. We know that the gallbladder contracts when there is fatty food. That is why we say patients with cholelithiasis, they should not have fatty foods, right? So fatty foods stimulating your cholecystokinin, so stimulates the motility of the gallbladder contraction. It causes relaxation of sphincter of OD. So basically what happens is, so you have the gallbladder, you have the common bile duct, pancreatic duct coming in, and you have the sphincter of OD. So this gallbladder contracts, okay, the bile is going here. So the sphincter of OD basically should relax. Okay, so remember that the gallbladder contracts, but the sphincter of OD relaxes. Also, along with that, the pancreatic duct wala, the pancreatic enzyme and bicarbonate secretion also it increases. And remember, it inhibits the gastric emptying, right? We said that cholecystokinin, A is for I, it stimulates the intestinal motility, but it inhibits the gastric motility, right? It inhibits the gastric motility. So this one is cholecystokinin, okay? Now going to the next one. This is the hormone which is stimulated by H plus in the duodenum. That is the acid. Okay. So acid in the duodenum stimulates this hormone. Fatty acids, predominantly it increases the bicarbonate secretion. So basically acid coming, you want alkali, the bicarbonate to neutralize. So this is which hormone? So basically this is secretin, right? This one is secretin, which is stimulated by acid. It stimulates the bicarbonate secretion, the alkali secretion from the pancreatic ductal cells, not from the acini. It does not stimulate the enzyme secretion, it stimulates the alkali secretion, right? And look at this one. It decreases the gastric acid secretion, the MCQ that we had already solved. Secretin, stomach mein everything inhibited. Okay. And the last one, which is the one which increases the insulin secretion, that is GIP, right? So you can see that in this table. This GIP can be stimulated by fatty acids, amino acids, and even glucose. Everything can stimulate the GIP, right? The insulin release, that is GIP. So this is the complete table basically that we had seen. So gastrin, G cells in the stomach. Where in the stomach predominantly these G cells are present? Is it the fundus? Is it the body? Is it the antrum? These are predominantly present in the antrum. Okay, the antrum of the stomach. Stimulus is peptides, amino acid distension inhibited by acid, somatostatin. This was cholecystokinin, gallbladder contraction, secretin, alkali, GIP is insulin. Okay, very, very important. Now going to the next one. Complete this table now. Okay, complete this table. Tell me what is this first hormone, second hormone, third hormone, fourth and the fifth. Okay. So what do you think are these hormones here? Let me zoom this image for you and show you this if you can. I hope you can see this table. So which is the first hormone here? Absolutely right. The first one here is gastrin, because you can see that it is SSS, that is, it is stimulatory on all the functions, be it acid secretion, be it gastric emptying, pancreatic, gallbladder, motility, insulin, everything is stimulatory. So this one is basically gastrin. All you need to remember for gastrin is all stimulatory. Okay, it is all stimulatory. Next one, look at the next one. If I zoom this, then the table is getting blocked. That's why this is the maximum that I can zoom. Look at the second one. You have to pick up the most important, points here to identify the hormone. What do you think is this hormone here? So this is the area which is more important here. Very, very important. Inhibits gastric motility, stimulates intestinal motility. What is that? Inhibits gastric motility, stimulates intestinal motility. So that is cholecystokinin, right? This is the one which is very important. The next one which inhibits both the motility, but it stimulates the secretions, that is going to be secretin. Okay, that is secretin. The fourth hormone which is only stimulatory on the insulin release, rest everything it has no effect or inhibitory only on insulin, so it is GIP. Can someone tell me what is the fifth one here, which only has the effect on the gastric motility and the intestinal motility? It stimulates gastric and intestinal motility. What hormone is that? So only related to motility, no other effect, right? So absolutely that's gonna be motilin. Okay, this is basically motilin, which has, as the term says, it has to do only with the motility and nothing else. So it stimulates the gastric and the intestinal motility, right? So these are the points basically that I want you to highlight, that when everything is stimulatory, it is gastrin. Stimulates intestinal, inhibits gastric motility, cholecystokinin. Secretin, stomach में everything inhibited, right? It inhibits everything in the stomach. Motility, both are inhibited. GIP, only insulin, motilin. So now remember that basically motilin is secreted by enterochromaffin cells and the M0 cells in the stomach, small intestine and colon. Okay. So gastrin stimulates all and motilin only stimulates motility. That is what you need to remember. The next point to be added here, we had mentioned secretin, stomach may everything inhibited, right? So it inhibits the acid secretion also and it inhibits the motility also, right? Everything is inhibited. Okay, so this is the entire table. Now, this is the points, the table where I've given you the points. Gastrin stimulates everything. Cholecystokinin inhibits the stomach motility and GIP is insulin. Okay? Okay, the same point, cholecystokinin. Remember, K is for I. It stimulates the intestinal motility, inhibits the gastric motility. Now, this is the last table, I believe, a quick review of whatever we have learned. All right, so let's quickly highlight the points here. Gastrin is secreted by the G cells, that is the antrum of the stomach, the main site. Stimulates the acid, gastrin, gastric acid, everything basically it stimulates. Stimulates insulin, glucagon and everything. The stimulating factors most potent is the peptide, right? Even calcium stimulates, GRP, that is the gastrin releasing peptide, which we said basically is via the vagus that all stimulates. What inhibits the gastrin? Do you remember the two things in the previous table that we had seen? It is inhibited by acid, the negative feedback, and it is also inhibited by somatostatin. Statin is static, right? Next one, cholecystokinin, K is for I. I cells are present in the proximal small intestine. Cholecystokinin, the main action is your gallbladder. Okay, remember that. It stimulates the pancreatic acinar cell. Now understand this point, that in the pancreas you have the acini and you have the duct. The acini secrete the enzymes. These are stimulated by cholecystokinin. It relaxes the sphincter of OD. It inhibits the gastric emptying, both cholecystokinin, secretin. It inhibits the acid secretion. It contracts the pyloric sphincter, right? So you have the pyloric sphincter that needs to be contracted to inhibit the gastric emptying, all right? And remember that secretin and cholecystokinin, they function together. Basically, the pancreatic secretion, both of them, so they function together. Most potent stimulator is peptide. Even fatty acid can stimulate, but remember, it's not the triglyceride. The fat should be the digestible form. So it's the fatty acid and carbohydrates do not stimulate cholecystokinin. So basically, it is peptides and fats. Remember, fatty acids related to gallbladder. Secretin is the S cells, again in the small intestine. The secretion of bicarbonate. Basically, remember, it is alkali. So it is stimulated by acid. Acid is the most potent stimulus for secretin because basically it secretes the alkali from the ductular cells. Inhibits the gastric acid secretion, stimulates the pyloric sphincter, and it augments the action of cholecystokinin. So cholecystokinin, secretin, bhai बहन के जैसे, they go together. ठीक है? And then we have GIP. I is for K. The K cells, it is the insulin release, the only action. And this is the only GI hormone stimulated by all the three types of food. That is glucose, fat, amino acids. Basically, all stimulate the GIP because insulin is in the fed state. Okay. So that is about this table. Now let us try do some MCQs. Tell me, what do you think will be answer to this one? Which of the following is true regarding the gastric emptying? Which of the following is true regarding the gastric emptying? What do you think would be the answer to this? Am I able to see the live chat? Let me see that. Absolutely right. It's A, that is cholecystokinin. We said that cholecystokinin inhibits the gastric motility, right? It inhibits the gastric motility, but it stimulates the intestinal motility, right? Gastrin is all stimulatory. Secretin, stomach mein everything inhibitory. Insulin is promoting the gastric one, right? Next, what is the primary site of production of gastrin? Gastrin, G for G, it is the G cells. And where are these G cells present? In the pylorus, in the antrum, in the pancreas or the small intestine. Basically, it is the antrum of the stomach. Okay, the main site is the antrum. Right, you have the K cells, I cells in the intestine. Okay. Next one, very, very important. All these are the previous year questions. So I'm giving you a quick review of the previous year questions. Maximum contraction of gallbladder. Maximum contraction of gallbladder is seen with gallbladder. Easy to remember. Gallbladder is basically cholecysto. So motility, the contraction is the kinin. So it is cholecystokinin. Okay, it is cholecystokinin which stimulates the gallbladder contraction. What does it do to the sphincter of OD? Does it contract the sphincter of OD or does it relax the sphincter of OD? What does it do? Cholecystokinin contracts or relaxes the sphincter of OD. You want the gallbladder to contract, the bile to go out into the intestine. So it relaxes the sphincter of OD. Okay, remember it relaxes the sphincter of OD. What does it do to the pyloric sphincter? Because it inhibits the gastric emptying, so it contracts the pyloric sphincter. It stimulates the pyloric sphincter. Okay. All right. Next one. Acid is the most potent stimulus for secretion of which of the following? Acid आया, हमको acid को neutralize करने के लिए we will need alkali. Alkali is the bicarbonate which is basically stimulated by secretin, right? It is stimulated by secretin. So the answer will be secretin. Answer will be secretin. Gastrin के लिए most potent stimulator is peptides. Cholecystokinin के लिए again it is peptides and fatty acids. GIP के लिए all glucose, fatty acids, amino acids, all of them can stimulate the GIP. Okay, all of them can stimulate the GIP. All right. So yes. That was about the quick review of the GIT hormones. I think you just need to remember 4-5 important points. The tricks that we have learned: gastrin is all stimulatory, cholecystokinin, K is for I cell stimulates intestinal motility, gallbladder contraction, secretin, stomach mein everything inhibitory, right? It inhibits everything in the stomach. It stimulates the alkali. Acid is the most potent. GIP is only insulin and it's stimulated by all the three, right? So that was a quick review of the topic of GIT hormones. Try solving MCQs on this. So this was to help you in the daily target. We will meet next at 8 p.m. Okay, for the free live class on the Unacademy app. And the topic is going to be, we'll simplify the muscle physiology. Basically the actin, myosin, the HAI, the light band, the dark band, वो सब हम करने वाले हैं. We are going to discuss. Okay, that is what we are going to discuss in the 8 p.m. class. It's gonna be a quick review of that. ठीक है? So thank you so much, everyone. I hope you have enjoyed this class, got to learn out of this class, and I hope you realize that topics which seem barbad, actually are not very barbad. They can be basically simplified and learned with easy tricks. So see you at 8 p.m. Till then, goodbye, take care, and keep studying, keep revising, and keep winning. Thank you.